Getting abnormal results back on a patient for labs or imaging or anything is one of the worst parts of my job as a primary care nurse practitioner. Here are the 5 things I do every time, though, especially when giving this information to them over the phone, that I have found make the experience the easiest all around for patients and hopefully the least overwhelming. So the very first thing I do is I ask them if they've seen the lab result or the imaging result already. This is going to soften the blow sometimes or make it less surprising for people, which can be helpful. And if not, then I know, okay, they're walking into this totally blind here. The second thing is I ask them if they are at an okay spot to review it right now. Now that's going to be different if they're in the office. Obviously, I still ask them, are you okay if we review this right now? But over the phone, it's particularly important. You don't know where they are or what they're doing. And I do tend to call people a lot with results because I wouldn't want to wait as a patient. The third thing, I will go ahead and explain to them what it's saying, the basic implication of that, and what it could in a very basic way mean, trying not to jump into any wild conclusions. The next thing I will do is I will give them one step and one step only. Most of the time, this is because people are just really overwhelmed and all they hear is that one result that they're getting. So I give them one job, and it's usually follow up with this person and give them the name of someone, the phone number, follow up here. And then fifth, I ask them to write down any questions that they have, answer any that they have right in this moment, but more importantly, write down questions that they have and they're going to have over the coming days as they're looking stuff up on the internet, as they're talking to other people, and schedule a follow-up appointment for about 1 week from now, if appropriate, or after following up with the recommended provider if it's something less urgent. And we can answer those at that appointment then. Don't over chat. I used to just word vomit at people because I was nervous, and I found keeping it simple is usually best. If you have any advice for giving people news that you would rather not give them, leave it below and we can all learn from each other.